Phacoemulsification of hard cataracts is often a challenge. The disassembly of a hard nucleus is very difficult since the nucleus fibers are strong and densely packed. Higher ultrasound energy, higher vacuum, and strong forces for nuclear separation may be needed, and these may lead to such problems as zonular tear, capsular rupture, endothelial trauma, and corneal burn. Recently, phacoemulsification of hard cataracts is widely performed instead of extracapsular cataract extraction. Divide and conquer is an excellent method of removing the cataract. However, the potential for wound burn and endothelial cell loss is increased. The increased capsular and zonular stress makes posterior capsular rupture much more likely. In addition to requiring less phaco power and time, chopping minimizes the stress placed on the zonules. However, there are several drawbacks of horizontal chopping. When performing horizontal chop, it is important to use the left hand, usually the non-dominant hand, skillfully. The chopping instrument passes peripherally beneath the anterior capsule and hooks the equator of the nucleus. In brunescent cataracts, there is little or no epinucleus. In that situation, horizontal chop can be dangerous. The phaco quick chop technique, vertical chop, a term coined by Daeyune, is an efficient refinement of the traditional phaco chop. Actually, this variation was described contemporaneously by several authors. Dr. Fukasaku's snap and split variation is also quite similar. The vertical chopper is used like a spike from above to impale downward into the nucleus, just anterior to the centrally positioned phaco tip. The most important step is to bury the phaco tip as deeply into the endonucleus as possible. The vertical chop technique is difficult to impale deeply and hold the nucleus against the vertical movement of the vertical chopper. To overcome this problem, we modified the vertical chop technique and named it the drill and chop technique. To hold the central and the hardest portion of the lens, we first drill a hole into the nucleus. Then, using the Kelman phaco tip with rotation clockwise, we can impale the phaco tip horizontally into the previous drilled lens. The central lens nucleus is drilled vertically with a Kelman phaco tip in sculpting mode. If we impale the nucleus vertically with the phaco tip, depressing the chopper downward, while simultaneously lifting the nucleus upward, this may cause torque or dislodge the nucleus. However, if we impale the nucleus horizontally, the phaco tip can hold the nucleus strongly against the downward movement of the chopper. The silicone sleeve is retracted, exposing more of the phaco tip in order to maximize a deep purchase. The central nucleus is impaled horizontally with a clockwise rotation of the Kelman phaco tip, using short bursts of phaco energy, starting at the point of the vertically drilled lens area. Whereas the conventional vertical chop technique uses a straight phaco tip, which impales the nucleus vertically, our technique uses the Kelman tip with rotation that enables us to hold the nucleus horizontally. The chop instrument is then placed just in front of or to the side of the buried phaco tip. Using the side port incision as a fulcrum, the distal tip of the chop instrument is then pressed downward into the nucleus as the phaco tip provides counteraction and a small degree of upward movement by a clockwise rotation of the phaco tip. Since we could hold the central endonucleus strongly with the drill and chop technique, and we could use the blunt chop in further lens manipulation safely. When there are posterior leathery strands that keep nuclear fragments attached to each other, the nuclear fragments are engaged and stabilized by vacuum of the phaco tip, while the nuclear fragments are partially drawn anteriorly, and the chopper is used to transect the strands. This is a 66-year-old woman with mature cataracts and severe corneal opacity due to limbal stem cell deficiency. It is safe to perform the vertical chop when the chopping instrument does not need to be placed peripherally into the fornix of the capsular bag. And by using the blunt chopper, capsular injury was minimized during lens rotation and nucleus segment removal. Three important steps of the drill and chop technique are: Number 1. Drill a hole into the endonucleus. Number 2. Horizontal impaling. Number 3. A blunt chopper tip lens manipulation.